Hello, this is Professor Capron. Welcome to this presentation on normal sinus rhythm. Let's take a look at the learning objectives for this presentation. By the time we're done, you'll be able to identify the characteristics of a normal sinus rhythm on an ECG, understand the physiological mechanisms underlying normal sinus rhythm, assess and manage patients presenting with normal sinus rhythm, and recognize the significance of normal sinus rhythm in relation to overall cardiac health. Here are the key terms for this presentation. As always, I'm not going to read them to you, but please do make sure that you understand each of these terms. And if you're still not understanding them at the end of the presentation, please come see me in class. So let's look at the specific ECG characteristics that define a normal sinus rhythm. A normal sinus rhythm is characterized by a regular rhythm. This means the intervals between each heartbeat are consistent. This regularity is crucial because it ensures that the heart is pumping blood efficiently throughout the body. On the ECG, you will observe evenly spaced QRS complexes, indicating that each heartbeat occurs at a predictable interval. Irregular rhythms indicate conditions such as AFib or other arrhythmias, which disrupt the heart's ability to pump blood effectively. In a normal sinus rhythm, every P wave is followed by a QRS complex. The P wave represents atrial depolarization, where the electrical impulse originates in the sinoatrial or SA node and travels through the atria, causing them to contract. Following the P wave, the QRS complex represents ventricular depolarization, where the impulse travels through the ventricles, causing them to contract. This one-to-one relationship is essential for coordinated atrial and ventricular contractions, ensuring efficient blood flow from the atria to the ventricles and then out to the body or the lungs. The heart rate rhythm ranges from 60 to 100 beats per minute. This rate is considered normal for adults at rest and ensures that the body receives an adequate supply of oxygenated blood. A rate below 60 beats per minute is called bradycardia, while a rate above 100 beats per minute is called tachycardia. Both of those conditions would indicate underlying cardiac issues or physiological responses that might require further evaluation. The PR interval is the time from the beginning of the P wave to the start of the QRS complex. It reflects the time it takes for the electrical impulse to travel from the atria through the atrioventricular or AV node and into the ventricles. In a normal sinus rhythm, the PR interval consistently measures between 0.12 and 0.2 seconds. This consistency indicates proper AV node function and efficient conduction of impulses. Prolonged PR interval would suggest first-degree AV block, while a shortened PR interval might indicate pre-excitation syndromes like Wolff-Parkinson-White syndrome. The QRS duration represents the time taken for ventricular depolarization, where the ventricles contract to pump blood out of the heart. In normal sinus rhythm, the QRS duration measures between 0.06 and 0.12 seconds. This duration ensures that the ventricles are depolarizing efficiently and synchronously, allowing for effective blood ejection. A QRS duration longer than 0.12 seconds might indicate bundle branch blocks or ventricular hypertrophy, which would impair the heart's pumping ability. So these ECG characteristics of normal sinus rhythm are fundamental for evaluating cardiac function. Now let's look at the physiology that causes a normal sinus rhythm. Understanding the pathway of electrical impulses through the heart and their effects on cardiac function is crucial for understanding how normal sinus rhythm is maintained and why it is so important for efficient cardiac performance. The SA node, located in the right atrium near the opening of the superior vena cava, is the heart's natural pacemaker. It initiates the electrical impulse that starts each heartbeat. The SA node generates an action potential at a regular rate, typically 60 to 100 times per minute in a resting adult, setting the pace for the entire heart. This impulse spreads rapidly across the atria, causing them to depolarize and contract. The regular firing of the SA node ensures a consistent and coordinated rhythm necessary for effective heart function. Once the electrical impulse is initiated by the SA node, it quickly propagates through the atrial myocardium, leading to atrial depolarization. This is represented by the P wave on the ECG. As the atria depolarize, they contract, pushing blood into the ventricles. This atrial contraction, also known as the atrial kick, is essential for completing ventricular filling and ensuring that the ventricles receive the maximum amount of blood before they contract. This process enhances the efficiency of the heart's pumping action, contributing significantly to overall cardiac output. The atrioventricular or AV node, located at the junction of the atria and ventricles, receives the electrical impulse from the atria. The AV node serves a crucial function by delaying the impulse slightly before it passes into the ventricles. This delay, represented by the PR interval on the ECG, ensures that the atria have enough time to contract fully and empty their blood into the ventricles. By providing this necessary pause, the AV node allows for optimal ventricular filling, which is vital for maintaining adequate cardiac output and effective circulation. After the delay at the AV node, the electrical impulse travels rapidly through the bundle of His, which is a specialized conduction pathway that splits into the right and left bundle branches. These branches run along the interventricular septum and extend into the right and left ventricles respectively. From the bundle branches, the impulse is conducted through the Purkinje fibers, which spread throughout the ventricular myocardium. This rapid conduction system ensures that the ventricles depolarize simultaneously, leading to a coordinated and forceful contraction. Ventricular depolarization and subsequent contraction are represented by the QRS complex on the ECG. This process is crucial for propelling blood out of the heart. The right ventricle pumps deoxygenated blood into the pulmonary circulation, while the left ventricle pumps oxygenated blood into the systemic circulation. The synchronized contraction of the ventricles ensures efficient blood flow to the lungs and the rest of the body, maintaining vital organ perfusion and overall homeostasis. Now, let's review the assessment of a patient with a normal sinus rhythm. So, the first step in assessing normal sinus rhythm involves evaluating the patient's hemodynamic status. This includes the blood pressure. We want to make sure it's within normal limits. Normal blood pressure indicates that the heart is effectively pumping blood throughout the body without undue strain. Consistent readings in the range of 90 over 60 to 120 over 80 are generally considered normal for adults. Assess the pulse rate and rhythm. The pulse should be regular, with a rate between 60 and 100 beats per minute. Palpating the radial pulse is a quick way to check for rhythm regularity and rate. An irregular or abnormally fast or slow pulse would indicate an underlying cardiac issue and would not show up as a normal sinus rhythm on the ECG. We want to evaluate the patient's overall clinical stability. Check for signs of adequate perfusion, such as warm skin, good capillary refill, and alertness. Stability in these parameters generally suggests that the heart is functioning well and that the normal sinus rhythm is effectively supporting the patient's circulatory needs. Remember that continuous or routine ECG monitoring is essential to confirm and document that the patient has normal sinus rhythm. So each P wave should be upright, uniform, and followed by a QRS complex. QRS complexes should be consistent in shape and duration, measuring between 0.06 and 0.12 seconds. The PR interval should consistently measure between 0.12 and 0.2 seconds, and confirm that the rhythm is regular and the heart rate is between 60 and 100 beats per minute. A thorough physical examination complements the assessment of hemodynamic status and ECG findings. So use a stethoscope to auscultate heart sounds. Listen for S1 and S2 sounds, which correspond to the closing of the atrioventricular and semilunar valves, respectively. These should be clear and regular. Any additional sounds, such as S3 or S4, would indicate cardiac abnormalities. Check peripheral pulses, particularly your radial and your dorsalis pedis pulses. If you can't get the dorsalis pedis, you can check a post-tib, but you should be able to find dorsalis pedis pulses. They should be strong and equal bilaterally. Weak or absent pulses may suggest peripheral vascular issues or poor cardiac output. And assess cap refill time by pressing on a fingernail or the skin and observing the time it takes for color to return once pressure is released. Normal capillary refill should be less than 2 seconds. Delayed refill can indicate poor perfusion, which is often related to compromised cardiac output. Let's discuss managing patients with a normal sinus rhythm. If necessary, we may need to continue to monitor ECG checks to make sure that the rhythm remains normal. This is not generally done on a typical healthy patient just walking around, but if they're in for surgery, they're post-surgical, they're in the ICU for any other reason, we're going to want to make sure that this rhythm remains normal. Utilize wearable monitoring devices if needed. This can be helpful for patients who have a history of arrhythmias. Holter monitors or event recorders can provide continuous ECG monitoring over extended periods. This can capture any transient abnormalities that might not be seen during a routine ECG. Ensure accurate interpretation of ECGs to detect any subtle changes that might indicate the onset of cardiac issues. Regular training and updates in ECG interpretation are crucial. Educating patients is a vital component of managing normal sinus rhythm. Key points to cover include diet, emphasize the importance of a heart-healthy diet, encourage all patients to consume a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Reducing sodium intake can help to manage blood pressure and prevent hypertension, which is a risk factor for cardiac problems. Patients should have regular physical activity because it's essential for maintaining cardiovascular health. Encourage patients to engage in at least 150 minutes of moderate intensity aerobic exercise per week, such as taking a walk, swimming, or cycling. Strength training exercises at least twice a week are also beneficial. Educate patients on the importance of avoiding risk factors that could compromise their heart health. This includes smoking cessation, limiting alcohol consumption, and managing stress. Explain the negative impacts that these factors can have on heart health and overall health. For patients who are on medications for other health conditions, stress the importance of adhering to their prescribed regimen. Non-adherence can lead to complications that could affect heart health. And regular follow-up appointments are crucial for ongoing assessment and management of cardiac functions. These appointments should include comprehensive assessments, including physical exam, review of symptoms, evaluation of any changes in health status. This helps in early detection of any deviations. Perform ECG monitoring during follow-up appointments if the patient has a history of arrhythmias to confirm that the sinus rhythm remains normal. This is very important for patients with a history of cardiac issues. Make any necessary adjustments to the patient's care plan based on the findings during the visits. This might include changes in medication, recommendations for lifestyle modifications, or referrals to specialists if needed. And engage patients in their care. Discuss their progress, address any concerns they might have, and reinforce the importance of adherence to their care plan. This collaborative approach can enhance patient outcomes. So, how would we expect to see a patient present if they're in normal sinus rhythm? Well, they're going to have a heart rate between 60 and 100 beats per minute. Blood pressure should fall within the normal range of less than 120 over 80 millimeters mercury. Stable blood pressure indicates that heart and blood vessels are functioning properly. A normal respiratory rate would be 12 to 20 breaths per minute. This would indicate adequate oxygenation and respiratory function. We want to make sure the respiratory rate is in sync with the cardiac function to support overall physiological balance. Patients in normal sinus rhythm should not experience palpitations. These are felt as a sensation of rapid, fluttering, or pounding heartbeats. The absence of this symptom suggests that the electrical impulses in the heart are following a normal pathway and the heart is beating efficiently. Lack of dizziness is a good indicator of adequate blood flow and oxygen delivery to the brain. Dizziness could signal inadequate cardiac output or arrhythmias that disrupt normal flow, so its absence is reassuring. Absence of chest pain is crucial because chest pain can be a sign of ischemia or other cardiac problems. Patients in normal sinus rhythm should not have any discomfort or pain in the chest area. This indicates that the heart muscle is receiving sufficient oxygen and nutrients. Patients should be able to perform daily activities such as walking, climbing stairs, and light exercise without experiencing shortness of breath, fatigue, or other cardiac symptoms. This reflects a well-functioning cardiovascular system capable of meeting the body's demands. Good exercise tolerance is a hallmark of normal sinus rhythm. Patients should be able to engage in moderate physical activities such as jogging, running, walking, swimming, or cycling without experiencing undue fatigue or cardiac symptoms. This shows that the heart is effectively pumping blood and supporting the increased physical demands. Overall, patients with normal sinus rhythm should have a good quality of life, free from cardiac symptoms. They should not experience any limitations in their physical capabilities or daily activities due to heart-related issues. Let's look at any related conditions and their significance when it comes to normal sinus rhythm. Well, normal sinus rhythm is a primary indicator that the heart's electrical conduction system is functioning properly. This implies that the sinoatrial node, atrioventricular node, and the rest of the conduction pathways are working in harmony to produce a regular beat. When a patient maintains a normal sinus rhythm, it generally indicates there are no underlying cardiac conditions. It shows the heart muscles are receiving appropriate signals for contraction and relaxation. This should lead to efficient blood flow and oxygen delivery throughout the body. This rhythm also reflects efficient cardiac function, meaning the heart is pumping blood effectively without any extra stress or strain. Efficient pumping helps in maintaining adequate perfusion to all vital organs, which is critical for overall health. Now, let's look at preventing any conditions that could disrupt normal rhythm. High blood pressure is a significant risk factor for developing cardiac arrhythmias. So, managing hypertension through medication, diet, and lifestyle changes can help to maintain a normal sinus rhythm. Chronic hypertension can lead to left ventricular hypertrophy and other structural changes in the heart, predisposing individuals to arrhythmias. Coronary artery disease can cause ischemia or infarction, which disrupts the normal conduction pathways in the heart. Preventive measures such as a heart healthy diet, regular exercise, and avoiding smoking can reduce the risk of coronary artery disease. Regular monitoring and management of cholesterol levels and blood pressure is essential. Encouraging a healthy lifestyle that includes balanced nutrition, regular physical activity, adequate sleep, stress management is crucial. Reducing intake of caffeine and alcohol and avoiding illicit drug use can help to prevent rhythm disturbances. Proper management of diabetes is essential, as uncontrolled blood sugar levels can lead to diabetic cardiomyopathy and other complications that affect heart rhythm. Regular monitoring and maintaining blood glucose levels within target ranges can help to prevent such conditions. We should always have regular checkups to maintain normal sinus rhythm. Routine ECGs, if necessary, can help to detect any deviations from normal sinus rhythm early, allowing for timely intervention. Annual checkups or more frequent monitoring for high risk patients are recommended to catch any changes in heart rhythm. Regular checkups should include blood pressure measurements, lipid profiles, and glucose levels. This will help to maintain overall cardiovascular health. These assessments help to identify risk factors that need to be managed to maintain normal sinus rhythm. And follow up care with healthcare providers ensures any emergency health issues are addressed promptly. Patients with a history of cardiac issues should have more frequent follow ups to monitor their condition and make necessary adjustments to their treatment plans. Educating patients about the signs and symptoms of disturbances, such as palpitations, dizziness, or chest pain, can lead to early detection and management. Encouraging patients to report any new or worsening symptoms immediately can help to prevent complications. So, to summarize, we've looked at the characteristics of normal sinus rhythm on an ECG. The rhythm is regular with consistent intervals between the beats. The heart rate is in the range of 60 to 100 beats per minute. Each P wave is followed by a QRS complex in a 1-to-1 ratio. The PR interval is consistently between 0.12 and zero point 0.2 seconds. The QRS complex should be between 0.06 and 0.12 seconds. We've looked at understanding the role of the SA node and the electrical pathway. We've looked at SA nodes, atrial contraction, the AV node, the ventricular contraction, and the ventricular repolarization. And we've looked at the clinical significance of maintaining and monitoring normal sinus rhythm as an indicator of heart health, monitoring for any changes, and preventing the development of arrhythmias that could show a damage to the heart tissue. Thank you so much for paying attention to this presentation today. Now go on, get out of here and go do some nursey things.